Hi everybody, this is Mark and this is my prostate cancer experience. Well, right now it's pretty much to the hour, 48 hours after I finished my surgery and went to recovery. And I wanted to bring you up to date as to what my experience has been so far in the last 24 hours and how I'm feeling today. Today, 48 hours later, within a couple hours, I'll be released and I'll go back to the hotel room that I'm staying at here in New York City. But overall, the process has followed the path that was expected. So basically, at this point, I still have the catheter, which I'll have for another 5 days or so. The pain that's associated with the surgery has really started to subside. There is a lot of pain around the belly, but that is slowly starting to diminish. And the big event today, which once again in everyday life you wouldn't celebrate, but a milestone after the surgery is the first time they're actually able to pass gas after the surgery. So if you recall, during the surgery, they fill up your abdomen with CO2 to facilitate the actual surgery, and that stays with you. Unfortunately, I believe your bowels and rectum, they kind of go to sleep. The body knows to make them dormant when your prostate surgery is in process and for time afterwards. So a milestone in the recovery process is the bowel being reactivated and coming back into action again. And the first evidence of that is the passing of gas. So until you pass gas, you're just allowed to eat clear liquids, soups, teas, that sort of thing. But it's a celebration. And here at the Lenox Hill Hospital and Dr. David Samadi's private wing, there's just a handful of gentlemen. Pretty much everyone's in the same boat. And I've made a couple of friends here today as we do our walks up and down the hall, because it's very important to do a lot of walking after the surgery. You get to know your neighbors, you get to share your own experiences. It's a great peer support structure. And they feel like new friends that you've met. You're all in the same position. What's interesting is we all are going through the exact same thing at the same time, the same ailments, the same complaints, the same discomfort, and as we continue to improve, we're all improving together. So the gentleman across the hall from me, he passed his gas about a half hour ago, and we're kind of celebrating that. So it's a very personal but enjoyable moment, but it also means that we're well on the road to recovery, and we're now able to start eating regular food, and I'm certainly looking forward to that. But on a bright side, I think I've lost a few pounds being in the hospital, and so who doesn't want to be a little more slim? As far as other things going, one thing I wanted to mention: this is November 2015, and it's customary during the month of November to create awareness to prostate cancer, to testicular cancer, and other male cancers, and so. What we tend to do is we don't shave. It's called No Shave November, or Movember is another way to call it. There's a couple different charitable organizations, and the idea is that you don't shave for the whole month, or you do a version of shaving. In this case, I'm trying to do a bit of a goatee, but it's just one of my ways of demonstrating and declaring awareness for men's cancer issues this month. And the money that's saved in shaving products is donated, but it's also something you can donate as well. But just Google online for No Shave November or Movember, and you can learn a little bit more about that. Now, having been potentially cancerous, or I was cancerous, the cancer is now gone, it does automatically put you into a category of full awareness. And not just awareness for myself and being cancer-free and celebrating that, but also helping others that maybe don't know about the silent killer. Prostate cancer is a silent killer. There's no symptoms. You have no idea that you have it, which is why I suggest that any male over the age of 40 years have their PSA tested, and to keep an eye on it. Work with a good urologist who can kind of help you out. I would suggest for any male that's even concerned about prostate cancer or urology to visit Dr. David Samadi. This genius of the field of medicine, genius as a surgeon, but as a doctor in general. He's just someone you want to know. He's someone who's very caring, and he'll help you through these issues. And he's skilled enough to get you through whatever you need to get through to get on the road to recovery. In the case of prostate cancer, he's an expert in the removal of the prostate. He's an oncologist, so he knows what he's doing, and he makes the experience great. And I can't rave enough. This right here, this is my, I call it a hotel suite. It's actually the hotel room. It's the hospital room at the Lenox Hill Hospital in David Samadi's wing, and it's unbelievable. But anyway, so I am being released today. I do feel a lot better, and I'm very positive. I'm very upbeat. If you're going through this process yourself, or if you're planning to go through a prostate cancer surgery, just realize that it's something you will get through. You'll have a couple of rough days along the road, but there is a support structure. There's other patients like yourself in the facility you'll be visiting. If you're here at the Lenox Hill Hospital, everybody's in the same situation, and you support each other. But it's good to have family with you as well. I wouldn't encourage you to go through this alone. It's good to have somebody with you. The hospital is very, very accommodating to your family, to your visitors, your guests. They can be with you as much as they want to, or as much as you want them to be. But anyway, so I'm going to continue this video series. Keep watching. Hopefully we'll get to meet some of the people involved, some of the surgeons, some of the people from the surgery team as well. And over the course of the coming weeks and months, I'll be updating this YouTube channel and just showing you my progress, and taking you through the recovery of continence, the recovery of erectile dysfunction, and also monitoring the cancer over the course of months and years moving forward. And if this is something that you can benefit from, it's my gift to you. It's something I want to share. I didn't find resources available to me to learn more about what the day-to-day process is. So hopefully this is something you can benefit from. So for now, this is it, and stay tuned for more videos.